Meeting is now streaming live on YouTube.
Yay!
Yay!
We got it. Hi, everyone. It's Geri White from Hudson Valley Physical Therapy.
Hey, everybody. I'm Zazu, Cioce from Hudson Valley Physical Therapy, and we are here to chat a little bit about just something that we hear fairly often, whether it be in the clinic or also just in our everyday lives with our, relationships, and that is about, leaking when you laugh. I leak when I laugh, but so does my girlfriend, and it's fine. That's what happens, right? That's normal, or that's expected. And there's really nothing you can do about it. Do you hear that, Geri?
So, yeah, I'm sorry. I really can't hear you well. We're having technical difficulties. I'm feeling like I hear some background double audio. I don't know if it's from me. Is it from me?
Yeah.
It is. So I'm going to let you talk, Zazu,
Okay.
and try to figure this out. Okay.
Okay. Well,
Sorry.
this is our first YouTube live, so technical difficulties are gonna happen, as we found out with our first Facebook live last week. So yes, this is something that we hear very often, and it is something that can happen, especially when you put it into the context of if you just delivered a baby, whether it be vaginally or by cesarean. There is a possibility that afterwards you're going to leak some urine because of the physical trauma that your body went through. But a lot of times we are told, by our friends or our family, all well-meaning, maybe even sometimes providers that we see, that we should just expect that, and that we just kind of have to deal with that for the rest of our lives. And they're not really given all of your options. Your options are really like, here are some pads, and go do what you got to do. And that is not all of the options. So
Right.
or do some Kegels, but
Right.
that is assuming that strength is the problem. And sometimes it's not strength that is the problem. Sometimes it's the coordination or endurance, or the like lifestyle factors like nutrition, hydration, bladder irritants, all sorts of different types of stuff that could be going on that's causing the leakage. But there is one common solution or provider that you can go to that is going to be able to provide you a detailed assessment and detailed treatment options that are basically, we're just guiding you how to fix yourself, and not have to deal with that anymore. It's a huge lifestyle factor that a lot of women and even men are dealing with, that they don't necessarily have to if they don't want to.
Right, right. And I don't know, I finally got my audio fixed. So, and I don't know if you went through this already, but again, it's become like the norm now, because you've seen ads up the wazoo about, using pads or liners, and it's okay to do, because now we're selling it like at the supermarket. You can buy it anywhere. So they're saying it's the norm, it's okay, and it's really not, because there is something you can do about it. And also people are getting, especially if they're post baby, however many babies they've had, their friends are probably going through the same thing. Their moms or their parents have gone through the same thing. So they're saying it's part of having a baby, and it really isn't. So, and people just accept it at this point, I think. So, which I think is really not the correct way, because there is something you can do about it. It is definitely controllable. Yeah.
Yeah, definitely. And it's different when, if you know what all of your options are, and that, okay, like I could get, very specific exercises and very specific techniques to me to try to fix this. Or I could use pads and, not address it at all. Or, just don't even do anything at all. Those are all options, and I'm sure there are more, but the importance is that all of your options. And so generally, when we're leaking, it's a big quality of life influence. People are, not going out as much. I mean, at this time, we're really not going out that much, but
Right.
you know, before we were socially distancing,
Mhm.
it's a huge quality of life. You know, like you can't go out with your friends, or you can't, you know, be out for such amount of time because you know that you're going to leak by a certain amount of time. You can't go running because you know you're going to leak. You don't know how many moms I have treated that have stopped doing the things that they love because they just don't want to have the feeling of wetting themselves
Right.
when they're doing whatever they like to do. And that's fair. But a lot of them, by the time they get to me, it's been months, years, and they had no idea that they could have came to me from the beginning
Yep.
and had
Exactly.
it nipped in the bud.
Right. Right. And again, same thing. So patients who are much older, in their 50s, 60s, who've had this issue, leaking since they delivered their kids, what, 20, 25 years ago. And again, norm, you know, they didn't think there was anything that they could do about it. And when they did go to their provider, they would just say, do your Kegels. And who really knows what to do with a Kegel except us. So, um,
Yeah.
and it's definitely hard to learn Kegeling through Dr. Google. So, and then again, that's a whole other subject that we talked about last week, but learning how to do a Kegel properly and effectively is going to help with trying to control your bladder issues of leaking. So.
For sure, for sure. So yeah, so last Monday, so we started this new series called Myth Busting Mondays. Last Monday, we busted some myths on Kegels. It was a great live
Mhm.
and filled with a lot of information. And so this coming Monday, we are going to have a postpartum myth busting Monday.
Mhm.
So lots of myths that we hear a lot with postpartum that are not true, or there's a lot of misinformation out there. And so, you know, get the facts straight and really know what you're dealing with
Right.
and how you can help yourself for sure.
Right. Right. So it's at 3 p.m. on Monday, and our Facebook handle is Hudson Valley Physical Therapy. And yeah, so we'll be on there and discussing a lot of things postpartum that are myths. So, and we're going to bust them out. So,
For sure. For
yeah.
sure.
Mhm.
This is just one of them.
Yeah, exactly. Exactly. So, all right.
So great. So
Yeah.
we hope you join us on our Facebook Live, where we're going to go in depth to a lot more of postpartum
Mhm.
myths and what you can do that are options that are going to be helpful for you. And it's at 3 p.m., like Geri said, 3 p.m. Monday. And we hope to see you there.
You there. Bye.
Bye.